Anyway, Doctor of the Year Award. Anyone who has the pleasure of knowing Dr. Lesley Saketkoo, I hope I said it right, knows that she is the definition of a steel magnolia. Her warm, friendly, and deeply compassionate nature is coupled with fierce determination, boundless energy, and laser focus that is further honed by an impressive resume, research, and clinical leadership. While she is among the international pantheon of scleroderma researchers, many of whom are in this room, Dr. Saketkoo, am I getting it right? Really started to engage with the Scleroderma Foundation in 2015 as we began preparations for the 2016 National Conference in New Orleans. Not only did she answer the Foundation's calls for help, she repeatedly volunteered to take on more work and come up with many ideas that made that year's conference one of our most memorable. Over the years, she has become the go-to person for our organization whenever we call upon her for her considerable expertise. But let me tell you more about our Doctor of the Year. She holds a MD and a Master's in Public Health and trained in Pediatrics and Internal Medicine at Tulane University in New Orleans and in Rheumatology at Louisiana State University. She is an Associate Professor of Medicine at the Department of Medicine at Tulane University and has held faculty appointments in both Pulmonary Medicine and Rheumatology. In 2011, she established the Scleroderma Sarcoidosis Patient Care and Research Center between Tulane and LSU, which has received international recognition. She also established a Pulmonary Hypertension Clinic program at LSU, which is now the LSU Tulane Collaborative Comprehensive Pulmonary Hypertension Center, where she is Co-Director of Clinical Research and Director of Wellness Practices. She currently sees patients at Tulane University Medical Center, and the Veterans Administration Hospital. The Scleroderma and Sarcoidosis Patient Care and Research Center is a recognized center of excellence by USTAR, the Scleroderma Foundation, and the Scleroderma Clinical Trials Consortium. She is an internationally recognized researcher, educator, and clinician in scleroderma, systemic sclerosis, pulmonary hypertension, and intestinal lung disease. She was the principal investigator of the large study that identified the minimum set of outcomes measures for connective tissue and disease-related lung disease, and also for the idiopathic pulmonary fibrosis for use in clinical trial. There's going to be a quiz on all this later, so stay with me. As many times as I read this beforehand, it just keeps going. That's how impressive she is. And she's the regional principal investigator for the FOREST study and the NIH-sponsored genome research in African American scleroderma patients. She leads international and local workshops for patients and medical professionals in the mindfulness in medicine, as well as a teaching program of safe, self-paced exercise for patients with cardiopulmonary disease and other chronic illness. And if that isn't all, but I will stop here. In all of her leisure time, she serves as an advisor and mentor to the Scleroderma Foundation team, stays in very close contact with her patients beyond the typical office visit, and in general, finds any way she can to advance the common goals of the scleroderma community through research, education, patient care, and advocacy. It is my honor and pleasure to present Doctor of the Year Award to Dr. Lesley Ann Saketkoo.
Thank you so much. To find words for this unfathomable honor, I think it might be wise to start with acknowledging the very kind and ever-faithful mentorship of legendary scleroderma scientists such as Dr. Virginia Steen, Dr. Maureen Mays, and many others, including Oliver Distler from Switzerland, and to acknowledge my loving colleagues, my national and international colleagues. And when I say my colleagues in scleroderma science, I mean my physician colleagues, my clinician researcher colleagues, but also nurses, nurse specialists, physiotherapists, occupational therapists, statisticians, research coordinators, and very importantly, patient advisors, who all come together to make all these advancements that we get to experience as we move through time with understanding systemic sclerosis. So yes, I did say loving. Yes, because that's the best word that I can think of to describe my colleagues. There is a strong and unimpeding current of joy and love that can occur in scientific medical communities. Something akin to perhaps what you see in spiritual communities, where we're driven by shared priorities and dedicated altruism, and this is undeniably ever present in the scleroderma scientific community. And so I'm deeply honored to be here today. But I want to say that this altruism and dedication of the scientific community is because of you, because of the patients, because of you, and bearing witness to the everyday and lifelong struggles that you and your families endure. We are inspired by you, and we are uplifted by your graciousness as you and your families rise to meet some of these very terrifying challenges. So it is you who are driving these advancements, and the way that you touch us with your magnitude of humanity. So you are the ones that are driving research and research advancements, and we admire you as our inspiration. So, and it's because of you that we have these advances now that are extending survival in systemic sclerosis, and coming up with solutions that intervene with impairments that minimize quality of life, amplifying the joy of life. So we admire you and your efforts to help others, and you help others through advocacy, through telling others about systemic sclerosis, telling your communities about systemic sclerosis. And I can attest that patients from my region and my center, that through their advocacy, their simple advocacy can be so simple, such as telling somebody about scleroderma. What is scleroderma? By raising awareness, patients in my own center, in my neck of the world, are saving lives, because what they're doing is they're making it more and more and more possible for early recognition and early appropriate treatment. And this is heroism. This is heroism that belongs to the scleroderma patient community. So I thank patients for driving us and making all these important steps come to fruition. But we could not be this community of researchers. We could not be this community of patients come together from all parts of the country and even the world, and create this massive unifying voice if it weren't for that which brings us together, that which organizes us together. And for this, we have to honor the Scleroderma Foundation. It is the 20th anniversary of this momentous foundation. And when I say momentous, it's a truism. 20 years ago, very few people knew or heard of scleroderma. And in the past years, this public profile has been changed by the efforts of the Scleroderma Foundation. And therefore, the Scleroderma Foundation is directly responsible for saving and increasing the quality of life of our patients. And that's the untiring efforts of people like Robert, like Carrie, Ryan, Shenna, Maureen, David, and their dedication is pure, crystal. And so a big hand to them. So I think this honor, the honor of this award is, it shall be carried in my heart every minute of the rest of my life, like the love of a parent, child, or close friend, inspiring my sensibilities to be better and to be kinder. And I thank you very much for this amazing honor. Thank you.